Hi. If you feel like you are not getting any answers, all the tests come back as normal, and the doctors tell you that it's all in your head, don't worry, you are not alone. I too was in your place not even a year ago. In September of 2023, I finally was diagnosed with POTS, otherwise known as postural orthostatic tachycardia syndrome. Today I'm going to be talking about POTS, the history behind it, and all that this syndrome entails. Alright, so what is POTS exactly? Well, postural orthostatic tachycardia syndrome is actually one of the more common forms of dysautonomia. Dysautonomia is the dysfunction of the autonomic nervous system, or the automatic nervous system is an easier term to describe it. As Dysautonomia International puts it, POTS is a common autonomic nervous system disorder characterized by an excessively fast heart rate and symptoms of lightheadedness upon standing. The autonomic nervous system is responsible for a great number of things that you probably didn't even know or realize were automatic. For instance, you have heart rate, blood pressure, breathing, digestion, and temperature control, just to name a few. Think about those times where you stood up too quickly or when you were leaning over and stood back up. You probably got a pretty bad head rush, right? Well, with people who have POTS, imagine that, but 10 times worse. There are many different ways that researchers have classified POTS too. Some of the more commonly used classifications are hypovolemic POTS, partial dysautonomic or neuropathic POTS, and hyperadrenergic POTS. It is very possible for someone with POTS to have 2 to 3 of these classifications rather than just one. Now, before we talk about the many different symptoms of POTS, let's get a little bit into the history of POTS and how it was actually discovered. Even though I have POTS, I myself don't really know a whole lot about the history behind it, so this will be new information for both of us. One of the main contributors to the research of POTS is the Mayo Clinic. Their team of researchers actually coined the term POTS in 1993. POTS isn't something new, though. It has been around for years and years, but in the form of many different names. According to Dysautonomia International, it has been known by other names throughout history, such as Da Costa syndrome, soldier's heart, mitral valve prolapse syndrome, neurocirculatory asthenia, chronic orthostatic intolerance, orthostatic tachycardia, and postural tachycardia syndrome. Now, with those names, doctors also believe that it was caused by anxiety, and that has been proven to be incorrect. Let's move on from the history of POTS, though, and turn more towards the symptoms that a lot of patients experience. Now, the symptoms of POTS can be quite complicated, so bear with me. There are a multitude of different symptoms that people with POTS can experience. Sometimes you can be experiencing all of them in one flare up, or just experiencing a select few. There really isn't a way to tell which symptoms are going to arise during a flare up. It almost seems like someone blindfolded you, gave you 5 darts to toss at a map, and wherever it lands, that's the symptoms you're going to be experiencing at that moment. The list of symptoms include, but are not limited to, lightheadedness, presyncope, which is a feeling of feeling faint, difficulty concentrating, shortness of breath, memory problems, cold hands and feet, muscle weakness, bloating, hand and foot tingling, low blood pressure, skin flushing, dry mouth and eyes, syncope, which is actually fainting, fatigue, tachycardia, which is an increased heart rate for any given reason, can even be when you're resting. I mean, for instance, I can be at work at my desk doing nothing stressful, just minding my own business, and all of a sudden I notice that my heart is pounding in my chest. Then there are headaches. I myself typically have at least 1 to 2 migraines a week. Nausea, palpitations, muscle pains, stomach pains, chest pains, tremulousness, which are tremors or shaking. For me personally, on days that I really struggle, my hands will shake just enough that it makes it hard to type, which can be frustrating at times. Additional symptoms include blurred vision, constipation and diarrhea, frequent urination, which is why doctors always tell us to increase our fluid and salt intake, and lastly, numb hands and feet. Now, with these symptoms, it varies in severity from person to person, and not every single person with POTS is going to be like the next. That's the complexity of POTS and why it can make it hard to get a diagnosis. Doctors have also been trying to figure out Figuring out how one develops POTS is a very tricky thing since not a lot of doctors have an in depth understanding of the condition. And when it comes to who can develop POTS, that's a little easier. According to Dysautonomia International, POTS can strike any age, gender, or race, but it is most often seen in women of childbearing age, between the ages of 15 and 50. Men and boys can develop it as well, but approximately 80% of patients are female. Additionally, Dysautonomia International actually has a partial list of underlying diseases and conditions that could be known to be associated with POTS and the cause of POTS like symptoms in some. This list contains amyloidosis, autoimmune diseases such as autoimmune autonomic ganglionopathy, Sjogren's syndrome, lupus, sarcoidosis, antiphospholipid syndrome, Kikuri malformation, deconditioning, delta storage pool deficiency, diabetes and prediabetes, Ehlers-Danlos syndrome, which is a collagen protein disorder that can lead to joint hypermobility and stretchy veins, genetic disorders/abnormalities, infections such as mononucleosis, Epstein-Barr virus, Lyme disease, extrapulmonary mycoplasma, pneumonia, and hepatitis C, multiple sclerosis, mitochondrial diseases, yes, the powerhouse of the cell, mast cell activation disorders, paraneoplastic syndrome, rare small tumors of the lung, ovary, breast, and pancreas that produce antibodies, toxicity from alcoholism, chemotherapy, and heavy metal poisoning, traumas, pregnancy or surgery, vaccinations, and vitamin deficiencies/slash anemia. In my case, trauma is how I got my POTS. I was playing baseball in a city league and was playing catcher in the first game of the season. The baseball fouled off the bat and then smacked me in the side of the head. That was my freshman year of high school, which was 2015, and I didn't get a diagnosis till September of 2023. So that kind of tells you how long it takes to get a diagnosis, which is going to be our next segment. Let's get right into it. Obtaining a diagnosis from a doctor can actually be a very frustrating and very long process, unfortunately. For me, it took about 7 years before I was diagnosed with POTS. Part of this is accredited due to the fact that I didn't really start to have any noticeable symptoms until after I graduated high school. All throughout high school, I was an athlete, and physical activity is a great way to treat and maintain your symptoms, so I never saw any symptoms due to this active lifestyle. A lot of people with POTS struggle with getting a diagnosis. Some have even had doctors laugh in their face when the patient tries to tell their doctor what symptoms they are having. People also have been told that it's all in your head, or all your tests came back normal, when in reality it isn't in your head and something is definitely not normal. What I would say to anyone that's going through the same thing is keep fighting for yourself and for answers. Don't let doctors push you every which way. I went from doctor to doctor for years before I was even diagnosed. It should not take that long to get a diagnosis, but sadly, there are not enough doctors that are educated about POTS and even dysautonomia in general. That is one of the reasons why I love Dysautonomia International and what they do. They are constantly trying to increase education to doctors of this condition and to recognize the signs. There are multiple ways that POTS can affect day to day life. It depends on the person and the severity of their symptoms. Some are able to return to work like normal with little to no change. Others have symptoms so severe it is compared to COPD patients. For me personally, I had to reduce my work hours. I physically cannot keep up with the conditions of 40-hour work weeks like I used to. That was really tough for me to accept and took some time to get used to. Days that I have really bad flare ups, I do have to stay home from work due to my symptoms interfering with my day to day routine. Now, with this, I don't want to make it sound like there is no hope if you are diagnosed with POTS. That is the absolute last thing I want you to think. Even though I have POTS, I still am able to enjoy countless activities with friends and family. Just the other day, I was able to attend a concert and got to meet my number one artist that I've listened to since they released their first album. I did have my bag packed with my essentials, that way, if I had any symptoms arise, I could combat them and continue on with my life. My life did not end the day that I received my diagnosis, and it doesn't have to end for you either if you get diagnosed with POTS. Now, what would be a good way to treat symptoms if they do start to arise? Let's go over that, and hopefully, some of these may even be able to help you out. People treat their symptoms in a number of ways. According to Dysautonomia International, the most common treatments for POTS include increasing fluid intake to 2 to 3 liters per day, increasing salt consumption to 8,000 milligrams to 10,000 milligrams per day, wearing compression stockings, raising the head of the bed to conserve blood volume, reclined exercises such as rowing, recumbent bicycling, and swimming, a healthy diet, avoiding substances in situations that worsen orthostatic symptoms, and finally, the addition of medications meant to improve symptoms. For me, one of the most challenging of this list has definitely been increasing salt consumption. I have a little pillowcase with 2 pockets, and I have salt on one side, but then I also have fast chew tablets that are packed with sodium and potassium on the other side. Treatment can be a trial and error process. You have to see what works and what doesn't. Some might work really well for you, but then for someone else, it has no effect. That is part of the complexity of POTS, is that it can be different for each person. While we all have similar symptoms, the treatment of those symptoms will usually vary. One of the other things that can be challenging to manage is the emotional toll of living with POTS. It isn't all you may think. In this section, I want to be as much help as I can. In no way should you tear yourself apart. It can be a challenge emotionally to manage living with POTS. I know very few people who would enjoy hearing from a doctor that they have a condition with no known cure. A lot of people will see a therapist to help talk about what they are feeling. If you're like me and don't necessarily like therapists for whatever reason, the next best thing would be to have a good group of people that you are close to that you can turn to if you need to talk. You could even turn to them to just hang out and be in the same room as someone else if that would help. It is very important that you build up a good group of people that you can trust and turn to in your times of need. One of the biggest things I can say with managing the emotional toll is just trusting that things are going to get better. I know that it can be very scary at first and it can be overwhelming, but trust and have faith in yourself that you will get better. That has also been one of the biggest lessons I've learned in this medical process, but there is more to it. All right. So, one of the biggest lessons that I have learned from this medical process is self advocacy. It is very important that you fight for your answers and believe in yourself. Don't let doctors push you from one specialist to another, conducting test after test and continuing to tell you that everything is fine or your test came back normal. I understand that it's very frustrating because I've been there myself. It is truly hard to hear time and time again that everything is normal and no news is good news. You'll want to just throw in the towel and stop the search, but that is when you should keep going. Answers could be right around the corner and you deserve to have answers for what is going on. Like I mentioned before, you have to trust and believe that things will get better. Yes, there is no known cure for POTS, but there are many ways that people treat their symptoms, and I've gotten to the point that they start to feel better. To go along with this, though, I do have some recommendations as someone with POTS that has gone through this challenging medical process. Let's get right into it. What would I recommend to those who think they might have POTS? I would first recommend that if you think you have POTS, that you try to get in touch with a cardiologist or even a POTS specialist if there is one in your area. They can run the tests necessary to see if you have POTS or not and can also help when you tell them your symptoms. Another thing that you can do is turn to social media for answers too. That is where I first heard about POTS and realized that, hey, what this person is talking about is the same thing that I have been experiencing. There is a huge community of people online that have POTS, and we'd be more than happy to answer any questions you may have. An additional good resource for information is just Autonomia International, because they have done extensive research and compiled all of that onto their website so that it is easier for you to learn about it. They also have testimonials from people just like you that have navigated these confusing times, and hearing these stories may even help you. It definitely helps to hear that there are others out there that know what you are going through. It helps so that you don't feel so alone, because that is the truth. You are not alone. You are seen and your concerns are valid. I really hope that this helped shed some light on POTS and might even be able to help some of you in your search for answers. Thank you for listening.